Hello, everyone, and thank you for joining today's webinar, How to Create Effective Workplace Mental Health Strategies for Mental Health Awareness Week. My name is Natalie Varanya, and I am the Marketing Specialist here at TalentMap. We have a special webinar presentation lined up for you today. We have Norm Baillie-David, Senior Vice President of Engagement here at TalentMap. For our clients joining us today, you probably already know Norm. He is TalentMap's in-house expert in workforce measurement and employee experiences, who works closely with our clients to help them really understand their survey data and improve their workforce through effective action planning. Welcome, Norm.
Thank you, Natalie. Good morning, good afternoon, everybody.
Perfect. And for our special guest joining us today, we have Paula Harrington. As the Director of Organizational Development, Paula is responsible for building leadership capacity, change management practices, and organizational effectiveness programs for the Center of Addiction and Mental Health. She is responsible for CAMH's workplace mental health consultative services and educational programs, working externally with organizations across Canada. Paula has more than 20 years of experience in leadership development, talent strategy, organizational design, and change management in both public and private sectors. Welcome, Paula.
Thank you. Hi, everyone.
Perfect. And for today's agenda, once I'm done with our formal introductions, Norm will start us off with an intro to mental health in the workplace and provide some statistics on the impact it has on employee engagement. Then Paula will provide a deep dive into what mental health looks like in the workplace, its associated stigmas, and how organizations can get started on creating an effective mental health strategy in your workplace. We'll also reserve the last 20 minutes for some Q&A. So before we jump right in, I wanted to give everyone a brief overview of CAMH and TalentMap. So CAMH, the Center for Addiction and Mental Health, is Canada's largest mental health teaching hospital and one of the world's leading research centers in its field. CAMH provides clinical care, research, education, policy development, and health promotion to help transform the lives of people affected by mental illness and addiction. Moreover, they provide training and consultative services to private and public sector organizations on the topic of mental health in the workplace. CAMH is also fully affiliated with the University of Toronto and is a Pan-American Health Organization and World Health Organization Collaboration Center. To learn more, you can visit www.camh.ca. And for TalentMap, for those of you who are not familiar with us, we are a trusted advisor in employee engagement and surveying. We have been in business for over 18 years, and in those years, we have conducted more than 7,000 employee engagement survey projects. Each year, we survey over 1 million employees across more than 500 organizations. At TalentMap, our sole focus is to partner with organizations to improve their workplaces. So how do we do this? We do this using 3 core elements. First, we ensure you ask the right questions when launching a full employee engagement survey, pulse survey, entry survey, exit survey, or 360 survey. Next, we uncover valuable employee insights by diving deep into the data and really analyzing the results. And lastly, what makes TalentMap truly unique among our sea of competitors is that we stick it out and we make sure you act on your survey results to make real change in your workforce through effective action planning and additional post-survey consulting services. And then as you can see from this sample of our clients, we've worked with a number of clients across North America in a number of sectors. And with our years of experience, we've established comprehensive industry benchmarks to put our clients' survey results in the context of their competitive marketplace. So now that you know a little bit more about TalentMap, let's get started. So I'll pass it over to you, Norm.
Thank you very much, Natalie. Again, good morning to you in the West. Good afternoon to those of you in the East. And those of you joining globally, I'm not quite sure what time it is. So as you know, those of you who are regulars on our webinar series, I always start the topic with a little bit of an intro in terms of why we chose this particular topic. And I think the best answer I can give you is, you can't see it, but we certainly can on our end, is the number of folks who registered for this and who are still signing on as I'm watching my screen has exceeded our biggest expectations. Were close to 500 folks who register for this. So the interest level in mental health in the workplace is something that we picked up on. We've started to see, obviously, in our presentations, in our interactions with our clients, in the engagement context. And of course, Paula, you've seen this directly in terms of working with your clients and helping them with mental health strategies, and you'll tell us a little bit more about that. But just, I mean, the interest in this is really shooting through the roof, and we see it in as it relates to employee engagement. But of course, it's a much deeper topic than that. So, Natalie, if you take me to the next slide, please. So the first thing I wanted to do is really give you a taste for that relationship between how engaged or disengaged employees are in mental health in the workplace. And of course, what you would probably be thinking intuitively is absolutely correct. There is a direct relationship between how engaged somebody is in the workplace and their mental health, as well as if someone is disengaged, is also going to adversely affect their mental health. And this chart just gives you a brief overview of that relationship. But what's not as clear is what's the cause and what's the effect. Is a good mental health practices in the workplace and supports contributing to engagement, or does engagement contribute to good mental health? And the answer to that is actually it's a cycle, it's a circle. There is no clear cause and effect. The two are completely symbiotic and related to each other. So now, if you take me to the next slide, the best way I can show you this is our own survey data. And when we do a survey, those of you who worked with us before will recognize this chart, our familiar quad map. And what we do here is we plot on a two-dimensional space how employees feel about a number of dimensions around engagement, things that may or may not influence engagement. So from top to bottom, what you're looking at are those themes on this particular example, where employees are feeling good at the top: work environment, inclusion and respect, mental health and well-being in this particular organization, and not feeling so good, things like communications or senior leadership. And so from left to right is what we see how has the biggest influence on engagement. Professional growth in this particular example has the biggest influence on the level of engagement. Now, the fact that mental health and well-being is up in that top left-hand corner, what does that tell us? What it tells us is it's actually a prerequisite. So there's topics such as mental health, such as respect in the workplace, such as discrimination and harassment, but particularly mental health, that if they don't exist within an organization, if the organization is performing or perceived to be performing poorly, then nothing else matters. This is what we call hygiene. These are prerequisites that unless and until we satisfy these requirements in our workplace, we can't even think about that next step around engagement. And so that's why we don't see mental health and well-being driving engagement directly, because it's a prerequisite. It has to be there. If it's not there, then we can't even think or talk about employee engagement. And so if you go to the next slide, Nat, what I want to show you is some data from some of our recent surveys where we do ask questions around mental health and well-being. And what you see here, at first glance, what you're looking at is a number of statements or attitudes around mental health in the workplace that we typically ask our clients. And by the way, the number of our clients, the number of organizations that are asking to have this built into their engagement surveys is increasing at an exponential rate. So it's becoming more and more a theme within engagement, and rightly so. And so when you look at the results here, what this tells you, green, blue, orange, the green are folks who agree with the statement on the left. The blue are folks who are in the middle, so they neither agree nor disagree. And the orange folks there are the folks who actually disagree with that statement or that attitude. And so at first glance, you look at overall mental health and well-being, 72% looks okay. Good majority feel that we're doing okay in the organization. And we even have some very, very strong results in terms of this organization being committed to an environment that supports mental health and well-being, so more than 90% in this organization. However, we can't interpret results on things like mental health in the workplace in terms of majorities, because this is the way we normally look at surveys. We look at majorities. And in this case, we have to be very attuned to what's happening on the other side of the ledger, what's happening in the minority situation. And you can see here, if you go to the next slide, Nat, please, you can see here that there are, on a number of these dimensions, there are significant minorities that are not saying, that are not endorsing that behavior or that the state in the organization, particularly in this example around interpersonal conflict. So here it's actually a majority in that case. So that's pretty evident. But in most examples, you're going to see all green and maybe 10 to 20% in the blue and the orange. And that's what you have to pay attention to, because that's what's actually going to signal to you the increasing need to have policies, programs, and strategies to improve mental health in the workplace. And as I was saying before we can even think about employee engagement, engaging these employees that are feeling that mental health isn't where it should be in the organization, we have to address this. And so if you go to the next slide now, and this is where I just wanted to show you one more example in the public service. This is public data. In the public service, we can see that now many of you, as I see it in your registrations, are affiliated or actually part of the public service, whether it's provincial, municipal, or federal. And we can see doing a good job in terms of raising awareness, describing one's workplace as being psychologically healthy. There are significant minorities who do not think that's the case. And so that sets the stage for a real need, and probably one of the big reasons why so many of you have signed on to listen to us today. So on that note, I'm going to turn it to the next slide, Nat, and pass it over you to Paula to tell people really what it is that people should be thinking about, should be doing in their workplaces around this all-important issue of mental health.
Great. Thank you, Norm. Hi, everybody. Thanks very much for joining us today. I want to start by just defining what it is that we're talking about. So we have a definition of mental illness and what it is and what it isn't. What it is it's a health condition characterized by alterations in thinking, mood, or behavior associated with distress and or impaired functioning. You're going to hear those terms, distress and impaired functioning, again and again as I go through some of the specifics of this presentation, because that's really where the difference is. That's really sort of the tipping point for when it becomes an illness. Simply put, people with this kind of illness are sick. They're not healthy, and they need help. They need treatment to turn things around. CAMH has done a lot of awareness campaigns and myth busting to try to help people understand what it is and what it isn't. And I think we're really turning a corner. I'm really seeing people becoming much more aware. There's a lot more attention being paid in social media and in the news. We're seeing this issue more and more. People are aware, and they're very aware in the workplace that it's time to do something about it. There is still some work to do, though, around the stigma. We're going to talk a little bit about that, but it seems that there are people who still struggle with it as a weakness, and they're afraid of being labeled. Mental illness is not who someone is. It's just part of their journey. We're going to cover this again a little bit later when we talk about stigma, but it's just something for you to keep in mind as we go through. So let's talk more specifically about what we see in the workplace. On the next slide, I'm asking you what mental illness and addiction issues you're witnessing in your organization. And I would ask you please to take a second and check all the ones that apply to you in your organization. What are you seeing? So we have stress and burnout at 93%. Yes, there it is. Anxiety at 89, depression at 70, substance abuse at 30, and then other at 22. Yes, this is very typically what we see. Stress and burnout are very big issues right now, and I'm not surprised at all to see this in the numbers. When we talk to organizations, these are the ones that we hear most about: depression, anxiety, stress, and substance abuse. I think, if we go to the next slide, So these are the three that we're going to talk about today. The stress is very concerning. It's emerging as an issue unto itself. It's always been kind of in the background, but it's really emerging now as something that needs to be addressed as a mental illness, and it needs some very specific strategies. I think many of us are familiar with what stress and burnout looks like, so I'm not going to spend time describing it, but I do want to take a look at the others. So let's start with depression. Depression is defined as a condition in which a person feels discouraged, sad, hopeless, unmotivated, or disinterested in life in general. I think we would say everyone gets depressed from time to time, or at least we often use that term when we're sad or disappointed. And people often ask me, when does depression become clinical depression? You can see in this definition that it says symptoms are present for more than 2 weeks. 2 weeks doesn't sound like very long. But I think what I want to draw your attention to is that it causes significant distress that interferes with daily activities, such as going to work or what's happening socially in your life. So when people ask me, when does it become clinical depression, what I think is important is actually to draw a bit of an analogy. In my mind, there are broken leg versions of mental illness, there are diabetes versions of mental illness, and there are cancer versions of mental illness. With depression, someone can be going through a difficult time. They can be reacting to life circumstances. It could be grief, sickness, loss, and they need help to heal, just as though they had a limb that needed to heal. It may turn out to be something longer term, or even a permanent injury that needs to be managed, just as diabetes is something that needs to be managed over a very long term. Or there could be suicidal ideation, which requires a crisis response. But for the purposes of the workplace response, what is important, I think, is not diagnosing the level of depression or worrying about whether it's a clinical level of depression, but instead recognizing some of the signs and symptoms and then opening up a dialogue to address it, having supports in place that someone can turn to, and directing people to get the help that they need. Similarly with anxiety, if we could take a look at anxiety, it's characterized by persistent, now in this case 6 months, and excessive worry characterized by restlessness, fatigue, muscle tension, and sleep problems. If someone is experiencing significant distress or impairment in social and occupational settings, that's when it's time to seek help. And again, anxiety is one of those terms that we use sort of informally, but when it's starting to really impair your day-to-day life, that's when it's time to go and seek help. Substance abuse is something that we also hear about in the workplace. Substance abuse or substance use disorder is characterized as a problematic pattern of using alcohol or another substance that results in, again, here it is, impairment in daily life or noticeable distress. We hear about organizations who are dealing with employees who are struggling with substance abuse. When it interferes with work and other obligations people have in their lives, that's when it's time to seek help. So what are some of the signs and symptoms in the workplace? This is probably the most popular question that I'm asked. What does it look like? How will we know? So what we have here on the slide is a list of some of the signs. We've compiled some of the indicators. You can see that there are changes in mood, angry, overreactive, appearance, the deterioration, bloodshot eyes, fatigue, weight changes, physical symptoms, being tired. If there's a substance use, with alcohol specifically, you may see some slurred speech. There may be an increase in accidents or safety issues. There will be changes in relationships, certainly strained relationships, people becoming more difficult to work with, and an impact in the relationships they're having at work is very commonly reported. And then, of course, the work performance. You'll see lower productivity, people taking a long time to complete work, or just not getting the work done, not being able to concentrate, quality slides, they become indecisive. And then there may be some defensiveness around authority when they're asked about these kinds of things. Frequent breaks, sick days, lateness. These are some of the signs that you can see. What you can see from this list is that these symptoms are not specific to a particular diagnosis. And the reason that we didn't put symptoms specific to a diagnosis is because everyone is unique. The signs and symptoms will manifest differently in different people for different diagnoses. The key is to notice when there's a change in behavior over time. One of our campaigns was about, not being myself today. If over a long period of time, if someone isn't themselves, if they're overreacting consistently in a way that really isn't who they normally are, that's when it's time to take a look at it. Your goal is not necessarily to diagnose. You're not expected to be a clinical expert. Your goal is just to recognize when something is happening and to open a dialogue and be supportive so that you can get to the bottom and help them get the help that they need. So just try to be aware, become aware of mental illness, become aware of the signs and symptoms, and we encourage you to have an open dialogue, to be understanding and supportive, understand what's happening, and then respond appropriately. And then the last thing that I would say is just a little bit of a caution. When we work with organizations, we do training in the workplace, and when I talk to leaders about what the signs and symptoms are of mental illness, this list could very well be a list of things that are happening for someone who is not struggling with mental illness. It could be something else completely. So to be open to the fact that it may be mental illness that is behind what you're seeing in the workplace, or it could be something else. So again, just open up the dialogue, try not to be jumping to too many conclusions, and just let the dialogue unfold and uncover what it is that's happening. Let's talk about the impact that it's having on the workplace. There have been studies that show what some of the costs are, and the costs are rising. So we know that annually, almost 3% of workers are on short-term disability leave related to mental illness. There was a statistic put out by the World Health Organization several years ago estimating that depression will be the leading cause of disability by 2020. And with 2020 only 15 months away, that statistic is really standing out for me. We know, we've all heard the 1 in 5. We know 1 in 5 Canadian workers experience stress-related illness, and we know that 1 in 5 Canadians will encounter a mental illness at some point in their lives. And then the last point on this page, that more than 30% of disability claims and 70% of disability costs are attributed to mental illness. That's a very substantial figure, 70% of disability costs, and it's growing. So this is, the business case for addressing workplace mental health is well-founded, and it's getting worse. In 2011, there was a study commissioned by the Mental Health Commission of Canada, and they tried to estimate what the economic cost to Canada is, looking at healthcare, social services, income support, and lost productivity. And the numbers are staggering, $51 billion a year in 2011. And I have to believe that that's higher now. So the impact on the workplace is becoming more clear as people are studying it, but clearly there is a strong case for addressing it. How common is mental illness in society? The 1 in 5 Canadians experiencing a mental illness or addiction issue in their lifetime is an often cited statistic. It is also several years old, and so it's the one that people are most familiar with. What they may not realize is that only 20% of people who experience mental illness will get help. And the youth and children issue, that mental health among children and youth is growing. That's a growing concern. Right now, 20% of children and youth will experience a mental health issue, and again, only 20% of them will receive services. To talk for a minute about where to seek help, where to get help if this is happening, we've just put together a list for you. We encourage people to start with your family doctor. So you can go to the next slide. We encourage people to start with your family doctor. If you have EFAP at work, Employee and Family Assistance Program, that's a very good resource. You can seek professional consultation from a practitioner with or without benefits. You can seek help from psychologist, psychiatrist, counselor, or therapist, usually with a referral from your family doctor, or if you're starting with EFAP, they can connect you. If it's a crisis, if someone is experiencing a psychotic episode or they are suicidal, call 911 or go to emergency for immediate attention. In Toronto, CAMH is located at the corner of College and Spadina. That's where our emergency department is, and you can go there 24/7 to get emergency assistance if you're in crisis. At work, you can seek assistance from your manager, human resources department, your union, if you're unionized, to try to support you and connect you with the supports that your organization offers. And then you can find more information on CAMH's website and on the website for the Canadian Mental Health Association. So why don't people get help? If there are resources available, why don't people seek out help? It's about the stigma. So I mentioned this earlier. What I said earlier about people struggling with being seen as weak or being labeled, it's very real. When I talk to people in organizations, they talk to me specifically about the career implications of coming forward and disclosing that they're struggling with something. They're worried about what's going to happen to their career. They're worried about how they're going to be treated in the workplace. So stigma is very, very real in many organizations. I'd like to do a poll to see how you feel about your organization. Do you believe that there is stigma attached to having a mental illness or addiction in your organization? Let's just take a minute and poll. Okay, so 47% say yes, 15% say no, and 37% say it depends. It depends where you work. This is consistent with what I hear in organizations. There are pockets of organizations where people are educated and aware, and they understand how to respond, and they're quite inclusive and have the right things in place, respond well, and accommodate people appropriately. And they manage well through it. And in the same organization, there can be areas where people don't necessarily know how to respond or don't respond appropriately. So I can see how in some organizations, particularly larger organizations, it would be the case that it depends where you work. And then in other organizations, it's just difficult to come forward because of the workplace implications that I mentioned. So thank you for that. The research supports this notion. The research suggests, there was a study done, and the research suggests 64% of employees are concerned about how work would be affected if a colleague had a mental illness. So they're worried about the impact on them and their own workload if someone on their team had a mental illness. 49% are unsure whether they would socialize with a friend or colleague who has a mental illness. And this is someone who already has a relationship with someone, a work relationship or a friendship. Then almost half of them aren't sure if they would continue to socialize. And then 39% of Ontario workers indicate they would not tell their managers if they were experiencing a mental health problem. So clearly, there is still a lot of work to be done around stigma. What can we do about stigma? If we go to the next slide, we have some suggestions on what you can do. I would say you need to start talking about it. Open up a dialogue. Starting with the leaders is important because, of course, the leaders signal to the rest of the organization what's valued, and they really shape culture. So starting with the leaders, if they can be role modeling, good behavior, supportive, inclusive, excellent accommodation. If people can be sharing their stories, leaders who share their stories, who can show that their career continued on a positive trajectory, even with a mental illness, and disclosing a mental illness, that's very powerful for people to see. People hearing from their other peers and colleagues. When we go into organizations, I've conducted training, I've conducted focus groups, and people will put up their hand and start sharing their story of what it is that they were struggling with and how they managed through it at work. It's very powerful for the people in the room, and it encourages other people to come forward and get the support that they need from their employer and get the help that they need. So very important for people to be sharing their stories, both at the leadership level and at the staff level. Educate yourself and others and be supportive. And I would just call your attention to the one about focusing on the whole person. Remember that having a sickness of any kind is not who you are. It's part of your journey. You have a much larger picture to your life. And it's important that people not put a label and only concern themselves with the sickness, but remember to talk to the whole person and take it in the context of the rest of their lives. As an organization, I've outlined a few strategies for you to consider. So you can go to the next slide. I thought about this from an organizational level and then as leaders and colleagues, and there are some sort of short-term things and long-term things you can do. As an organization, you want to make sure people know what supports you have in place. When we go into organizations, we often hear that people aren't aware of what they have now. And the organization may, in fact, have lots of things in place. So you just need to communicate and educate, make sure people know what they have available to them to support them, whether it's EFAP or it's educational resources, make sure that people know what they have available to them. Do some analysis to understand the specific issues in your company, and draft a strategy aligned with your organizational objectives and values. The national standard for psychological health and safety in the workplace was a standard that was put out by the Mental Health Commission of Canada a number of years ago, and it's a very important resource that articulates what a psychologically safe and healthy workplace looks like. It's very specific. There are 13 factors, and each factor has a number of statements that articulate what does it look like to have good psychological health and safety in the workplace. It's a terrific resource if you're looking for a guidepost on what you want things to look like in your workplace. Educate the leaders and the staff on how to support each other, and have them champion good mental health, build strong relationships so that people can come forward and disclose. When someone is struggling with a mental illness, they're worried about their job, they're worried about what people are going to think about them, and it's very personal to them. So the stronger the relationships, the more likely they are to come forward and disclose and be confident that they're going to be supported by their colleagues and their organization. A few specific things that we're seeing other organizations do is to have senior leader champions and to incorporate mental health into their wellness programs. That you want to be very sure that you have more leaders than just your human resources leaders championing the mental health initiative in your organization. It's important that people see leaders from HR and also the business championing good mental health practices in the workplace. We've seen organizations do wellness events. Sometimes they do charity events aimed at reducing stigma. You can be very creative with some of these events. And again, it just helps normalize and encourage people to come forward. Having guest speakers who have what we call lived experience, or people who have had or continue to have a mental illness or addiction, is very powerful for people to hear their stories. And as I mentioned, having internal people share their stories about what they've struggled with and how they've managed through it, very powerful for the organization. Education, we've talked about. Peer support programs are becoming very popular right now. People are looking for support from their peers, maybe even before they're ready to go to their direct supervisor or manager. They do want to turn to their peers. So having a peer support program and helping skill up peers to support each other is a very popular and very powerful, important thing to do right now. On-site counselors are something that we hear about frequently when we talk to organizations about what they would like. They want someone on-site that they can go talk to, who is trained, who's confidential, who they can trust, and get the information that they need and the support that they need. And then return to work policies and processes. I would suggest that you take a look at what your policy and your process is, and make sure that you have good processes in place and that you follow through carefully to make sure that it plays out the way it's intended to. Returning people back to work and finding them meaningful work to do that they can contribute in a gradual way with the appropriate limitations that they have is a very important part of getting people back to work. And we want to get people back to work sooner, because the longer they're off, the harder it is for them to come back. So having solid return to work policies and processes is an important place to look. I'd like to stop and do a bit of a poll to see how many people on the call today have a mental health strategy in place. So just to give us a sense of where you are, whether you have one, whether you've implemented some things but maybe haven't formalized a plan, you've talked about it but haven't quite gotten around to implementation yet, or if it's not on your radar at this time. So please, if you would, just give us a sense. Okay, so we have 14% have a strategy, 47 have implemented some things but don't have a plan yet, 20% have talked about it but haven't started, and then 19 have not started to address this issue. So we have, just do some quick math here, 61% have taken some serious steps towards addressing mental health in the workplace, which is fantastic. That's true. Congratulations. And to the 20% who are talking about it but haven't started, that's a great place to start. You know, the fact that you're aware of it and you're starting to talk about it is a great way to begin. And then as you formulate your plan and where you want to go, then you'll be on your way. So just a word on the next slide. Then I've given a bit of an indicator of how to get started. So if you're just starting, or if you're sort of retrofitting a plan to some of the initiatives that you have in place, with any strategy, I would suggest that you start with a current state assessment. So you can do an inventory of what you have in place. As I mentioned, it's important to communicate to people what they already have. And you want to start by really understanding the problem that you have in your organization. Look at your data. There is data like short-term disability, long-term disability, turnover, some of the trends in your claims, and your EAP data, grievances if you're unionized, productivity indicators, your engagement survey results. There is data that you have to use that you can quantify your issue and find out where you should focus. You want to understand what your priorities are. Next, set a vision. Develop some goals and measures and do a plan. You can implement short-term wins while even you're doing your plan. There are things that you can do to start the dialogue, start some of the awareness building, do some education. It's a good place to start even as you're building your plan. But then when it's remarkable how people will share their stories given the opportunity, so that others will feel supported and reach out for help. So create those opportunities with education, with awareness, with events. And then you want to do a plan, start implementing your plan and measure, and keep adjusting your plans as needed based on, whether your priorities change or you're seeing progress, or people will, as they're participating, will come up with more ideas and suggestions and ways to strengthen your plan. A few things for you to keep in mind. Think beyond HR. So I mentioned you want to get sponsorship from business leaders in addition to HR. Try to get those champions from across the business to support this initiative. Engage everyone in the design. The people who will use the supports you put in place are the best people to ask what they need and how they should look, what specifically they need, how they'll access it, what's important to them. Try to engage people. We conduct focus groups, we do surveys, we try to get as much input from people at all levels of an organization before we start to help work with the organization to build a strategy, because they have the best ideas on what they can do. There are some global things that we can put in place, but there are some very specific ways of implementing some of these initiatives that will really be meaningful to people, and the people who are going to use the services, they're the ones who will help you design them so that they resonate the most. And finally, I would say people want to know that the senior leadership is supportive. Communicate, communicate, communicate. Really try to get the dialogue going. Try to get that senior level visibility and support. And I will leave it at that. I'd like to say thank you. I know we do have some time for questions, but thank you for listening, and thank you, Norm and Natalie, for the opportunity.
No, thank you, Paula, and thank you, Norm,
absolutely.
as well. Yeah, that was really great. It was a lot of valuable information, I think, for our listeners, a lot of great points, and I feel like we can keep talking about mental health in the workplace forever. So for our audience, if you haven't submitted a question yet, please feel free to do so now using the right hand or the question panel on the right hand side of your screen. And while more questions come in, I do have a few things to mention. So we've been working very hard here at TalentMap to provide additional resources for our clients and subscribers. We regularly post new articles to our blog that provide quick tips, tricks, and a look at industry trends, as well as some thought leadership pieces to keep you in the loop. We've also recently launched a resource library where you can find more in-depth content pieces, including downloadable how-to guides, checklists, and info sheets to help guide your employee engagement initiatives. All right, we have a bunch of questions that have come in, really great questions, so I'll go through them, and then Paula and Norm, you can take turns on who wants to answer questions. So let's jump into the first one. The first one is from Denise. Her question is, our challenge is that we provide the recognition and support. However, in Canada, getting help that is not costly often takes months and is very inconsistent and unorganized for someone navigating the system. What can organizations do about this?
That's a great question.
Yeah.
That is a great question. Access to care, I would agree that the mental health care is not as organized and centrally accessible as some of the other services that we have in our healthcare. Certainly, and it's provincial, so I'll speak to Ontario, but there are lots of supports available. We at CAMH, we instituted something called Access CAMH. It's a 1-800 number. I should know the number off by heart. I don't, but if you look at our website, you can find Access CAMH and give them a call. Someone will answer the phone and try to direct you on where to go to get help. It is, I recognize it is a difficult system to navigate. We also have a family engagement team here at CAMH, that if you are, a family member, or you're supporting a friend or someone who is trying to navigate the system, we have the Office of Family Engagement here at CAMH that has information, resources to help you navigate. We recognize that it's a complicated system, and so I would suggest contacting Access CAMH or the Office of Family Engagement with questions, and try to get some help. The third place to go is your family doctor. Your family doctor can be acting almost like a case manager for you, to try to direct you to different supports, and hopefully you can check back in with your doctor to track how you're doing with those different supports, and get additional recommendations from them.
Perfect. And for the second question from Nancy, really great question. So how do we open a dialogue without seeming to disrespect an employee's right to privacy of their medical information?
Yeah, great question. Great question. Mental illness is a recognized disability according to the legislation, but people are not required to disclose their illness. However, the employer is required to, if they ought to have known that there was a mental illness, then they have a responsibility to accommodate. So opening up a dialogue without, asking people specifically what's happening with them is it's a sensitive and difficult conversation to have. It probably won't happen the first conversation you have. If you're talking about a one-on-one conversation with somebody and you've noticed that something is happening with them and you suspect there might be something going on, and you do all of the right things, find a private place to speak. It's someone you have a good working relationship with, and you inquire gently about, them not seeming themselves, and, is there something happening that you could maybe support them with? I would expect them not to necessarily disclose to you the very first time you have this conversation, because of all the stigma that we talked about earlier. It may require a series of conversations before they're ready to disclose what's happening with them. And in fact, they don't have to tell you specifically what's happening, but they can still access the supports. You can direct them to the different supports that your organization offers, and your own support as their leader, without knowing specifically what's happening with them. So I know it's sensitive, it's a delicate balance, but just try to maintain, the dialogue. Expect that it may not go well the first time, and that's okay. You may need to have a series of conversations to get them comfortable with the idea that you are there to support them, and try to make them aware of as many of the supports that have available as possible.
Perfect. So we'll move on to the next one. This one I think Norm can probably chime in on as well. So this one comes from Christine. Her question is, would it make sense to include questions on employee and organizational mental health in our engagement survey? And if yes, how many questions? And if you could propose some wording for these questions.
Oh, absolutely. So I think there's three options. There's conducting, essentially adding on a number of questions to the standard engagement survey on the topic of mental health, which is something that we do. We call that a bolt-on. That some organizations choose to do that. And the objective there is really to understand at a very superficial level the relationship between mental health in the workplace and employee engagement, but primarily you're still measuring engagement. If, however, your objective is really around to understand the situation in the workplace and the perception of mental health supports and mental health in the workplace, and particularly attitudes around stigma, then we would probably propose that you do a specific survey around mental health in the workplace, because it's too deep to cover jointly with an engagement survey, and it really is kind of different. So the short answer to your question in terms of the questions and wording, we have an entire library of questions around mental health in the workplace, health and wellness, etc. And if you contact myself, or my contact information will be at the end of the presentation on the slide. I'll be more than happy to have a discussion with you around what some of the options might be around wording, questions, it's questionnaire development, etc.
Perfect. Thank you, Norm. Next question is from Ashley. Her question is, shouldn't stress and burnout be two separate things? People can be stressed without being burnt out.
I think that's a valid point. I would say I'm not a clinician. We are studying it. We do have clinical area that is studying stress and burnout. So I can't give you sort of the clinical response on whether they're two different things, but I can certainly understand that perspective. Certainly, there's a healthy amount of stress that occurs before you achieve burnout. But I think that what we're talking about as a problem in the workplace is probably that unhealthy level of stress that does approach or is in the burnout phase. But certainly, yes, there is a certain amount of healthy stress that's actually motivating, I think. But there's a tipping point there where it starts to become problematic and in fact is inhibiting people from their peak performance.
Perfect. Thank you, Paula. And another question related to burnout is from Namira. So her comment and question is, a big contributor to burnout is overwork, particularly administrative work. She says that one organization in New Zealand recently tried a 4-day work week, but people were paid for 5, and it turned out to be very successful. So her question is, would this sort of initiative be able to be introduced into the public sector? If you could comment, I guess.
Well, as an employee of the public sector, I'm very supportive of that idea. That's a great idea.
Yeah. I read the same article, and the actual implementation, if we're talking about public sector, it really is, if you're a member of one of your public sector unions, you need to get that on the agenda for the next round of collective bargaining. That's basically where that's going to be hashed out. So that's not something that can be implemented by any single public sector organization. That's going to have to come union by union, negotiation by negotiation.
Mm-hmm. There's also some interesting research coming out now about countries like Germany and I want to say France, who are deliberately not preventing a lot of emailing after hours, and the impact that that's having on people, because we know that, I mean, people take their work home with them literally when we walk home with our phones, and we're looking at our phones and on our email after hours. And so we're seeing a lot of work being done to try to do work during the work day and then split that from your personal life when you leave. So it's interesting to see that, these large scale initiatives happening to try to address the stress that people are experiencing from working too much and not enough work-life balance.
Yeah, absolutely. I mean, we've done quite a bit of work. I'm very familiar with the German situation, being of German stock. It's actually it wasn't that big a leap in Germany because it's part of the culture. The separation between home and work is a much more, it's much better compartmentalized, and people by their very nature didn't tend to want to answer the emails and things like that. They would turn off the phones, or more likely to, more naturally as cultural. But so the change in the law, the labor law, actually reinforced an existing practice by and large. In France, it's a little bit different. In France, they reduced the work week from 35 to 30 hours in the work week. But what's actually happening is there's a spillover, and people are actually voluntarily, especially at the management levels, they're voluntarily staying on email, staying connected, because they feel too compressed in that 30-hour work week, and there's some rancor. The unions, the public, not just the public sector, but the unionized sector has, of course, taken to this very, very enthusiastically. The business sector in France is still quite opposed.
Right. It's interesting. It's great to see these large initiatives addressing basically mental health in the workplace.
Oh, absolutely.
Yeah.
Yeah, that's really great insight. So we'll move on to the next question. So the next one is from Braden. His question is, how do you begin to help those who don't want help? Which is a really good question.
That is a great question. That is a great question. Again, people don't have to disclose. They really don't, and everybody is different. I think that what you can do as a coworker, as an employer, as a manager, is do everything that you can to make it comfortable for the person to come forward, offer the supports, open the dialogue, make supports available that your organization has in place, encourage them to address the issue with, again, if they're not telling you what the issue is, but encouraging them to try to get some help, having people share their stories and try to destigmatize it. These are all the things that you can do. Ultimately, you can't force somebody to go get help, but all we can do is try to put all of the right sort of success factors in place, that if they do go and get the help and they do try to address it, that you're doing everything for them in the workplace to enable that.
Perfect. Next question is from Adriana. Her question is, do you have any suggestions for gauging remote workers?
Yes, remote workers. So, I mean, I am wondering about the survey. When you're dealing with people remotely and you're used to working through technology, connecting with them through technology, a survey I think can be very helpful to check in and see how they're doing. I would say that just like my own experience working remotely, because I have done it. I have had situations where my whole team was remote. We were all in different cities, and connecting by phone, just trying to have like a live conversation with people to see how they're doing. You can use technology like Skype and what have you to try to see each other. That's helpful because you can often gauge more by seeing the person than you can over the phone, but certainly over the phone you can gauge more than just through email. So I would say just try to be in contact with people, checking in with them and seeing how they're doing, not just getting a status on where they are with work, but checking in with them to see how they're doing. If you can do that, you can try to stay connected with them as people and check in with how they're doing in terms of their health.
That is perfect. Thank you, Paula. One more. I think we have time for one more question, one or two more questions. Next one comes from Sarah. Her question is, are there any free or reasonably priced speakers or facilitators they can bring in to speak to employees or leaders? For example, through CAMH or CMHA? And if so, what would be the best way to go about this?
You can, if you're interested in a speaker from CAMH, you can contact me and I can connect you with our public affairs department and see if we can find someone for you. You can go to CMHA's website or the Mental Health Commission of Canada's website for different resources. There are companies like Speaker Spotlight who represent quite a number of speakers, and you can just go to their website and look up topics and find someone there. They have quite a number of speakers that they represent. That would be my suggestion if you're looking for a specific speaker.
Perfect. I think we'll do one more question, and then just a reminder to everyone, if we haven't been able to get to your question, I will follow up by email. I'll have Paula and Norm read your questions, and we'll send their answers as a follow-up. So for the final question for today is from Christine again, actually. She says that a number of stigma reduction and mental health awareness she's hosted or has been engaged in are very short-term, one-off event types of activities, and we do not measure long-term impact. So her question is, do you have any suggestions for ways to measure impact over time, either individual or at the organizational level?
Yeah, it's a great question. Sustaining and embedding change is the hardest part in any. This is a change management exercise. You're effectively trying to change culture, and
That's
so
right.
doing, launching activities and that kind of thing is point in time. Building things into your performance management system, building things into the kind of dialogues that leaders have with staff. We built some things into our 360 assessment. We built some things into our leadership competencies to try to build capacity around leaders for keeping psychological health and safety in the workplace and effective teams. Those are some of the things you can look at. Look at your processes, your infrastructure. Look at what you're promoting and recognizing in leadership and what you communicate about on a long-term basis to try to build that sustainable change.
Perfect. Thank you so much, Paula. So I think that is it. Thank you, everyone, for all of your great questions. Like I mentioned, if we weren't able to get to your question, we'll be sure to follow up by email. So that's it for our presentation today. Thank you again, Paula, and thank you, Norm, for taking the time to present. And thank you, everyone, for joining us. I hope you enjoyed, and hope you'll also join us again. So bye, everyone, for now.
Thank you very much, everybody. Have a good day.
Thanks, everybody.